Welcome to Study Loop.
Hey everyone, today we're solving problem number 16 from chapter 16 of the textbook, which asks us, what is the key difference between a fee-for-service healthcare system and a system based on health maintenance organizations? So I've taken out a mini section from our reading that essentially gives definitions for fee-for-service basis and HMO, which is the common abbreviation for health maintenance organizations. So let's read this section. It says, a final way of reducing moral hazard, which remember is when you engage in riskier behavior with your insurance than you would if you didn't have any insurance at all. So a final way of reducing this, which is especially applicable to healthcare, is to focus on healthcare provider incentives of providers rather than consumers. Traditionally, most healthcare in the United States has been provided on a fee-for-service basis, which means that medical care providers are paid for the services they provide and are paid more if they provide additional services. So fee-for-service is exactly how it sounds. It is when medical care providers are paid according to the services they provide and the amount of services that they provide. However, in the last decade or so, the structure of healthcare provision has shifted to an emphasis on healthcare maintenance organizations. So now I'm going to switch colors to blue. A health maintenance organization, abbreviated as HMO, provides healthcare that receives a fixed amount per person enrolled in the plan, regardless of how many services are provided. In this case, a patient with insurance has an incentive to demand more care, but the healthcare provider, which is receiving only a fixed payment, has an incentive to reduce the moral hazard problem by limiting the quantity of care provided, as long as it will not lead to worse health problems and higher costs later. So basically, how we would define an HMO is that it's an organization that provides healthcare and is paid a fixed amount per person enrolled in the plan, regardless of how many services are provided. So fee-for-service is exactly based on, is 100% based on services that healthcare providers actually provide, whereas HMOs are not at all based off of how many services are provided, but rather a fixed amount per person enrolled in the healthcare plan. So that is the key difference between a fee-for-service and a health maintenance organization, or HMO. If you guys enjoyed my video explanation of this problem, please hit the like button next to it. I hope you all have a nice day, and thank you for watching.